Brought to you by NJM.
Welcome to New Jersey Capitol Report. I'm Rafael P. Roman.
And I'm Steve Adubato. It is our pleasure to welcome on Capitol Report Norman Rogers, who is the president of the New Jersey State Nurses Association. Good to see you, Norman.
Norman,
Thank you.
welcome.
It's always good to see both of you again as well.
Well, we're here to make it clear to folks we're in the heart of Newark, New Jersey at the North Ward Center, and I want to thank the folks at the Center for allowing us to tape Capitol Report here. Gun violence. Again, we are in Newark, or whether you're in any city or even suburbs across the state and this nation, a huge issue. The question is, why is gun violence such a big issue for the Nurses Association?
It's becoming a public health issue. And unfortunately, we don't have the research studies that we need to pull out that data so that we can clearly show how it is. Nurses have a direct impact on the patients that come through the emergency rooms, take care of both the patient, the family, and the communities after any type of gun violence, helping them get through their rehabilitation, helping them try to get back to some sort of normalcy in life. So the nurses are always there on the front line, hands-on, helping heal in whatever capacity is needed, helping comfort whatever capacity is needed. So it's becoming a really issue. And it's not just nursing, it's all healthcare is having an impact. The costs continually going up as you have each of these different types of violent events.
So Nora, we want to get to specifically how it affects the nurses in 1 second, but you said something about how you don't have the necessary data about gun violence. Explain why that is.
Well, there's currently within the legislation, the national United States legislation, that there is a small sentence that keeps the CDC,
Centers for Disease Control.
Yeah, the Center for Disease Control, from doing any type of research using the funding that's provided. This one small bill that's over 20 years old that keeps them from doing a research study. And so that's one of the things that we're pushing for right now, is that the legislation take a look at those old bills and laws and allow the CDC to do the research necessary, because it is not only going to show us, we're hoping, the data of how much gun violence there is, because everybody has numbers but not the number, show us how it impacts the communities, how it impacts a person individually, and what that looks like to the health, and what that cost is to the healthcare system.
Norma, help us understand this. For nurses across the state, this region, this nation, gun violence, those emergency rooms, what's it like for them?
It's as traumatizing to the nurses sometimes as it is for the patients and their families that are coming in. It could be somebody that's your neighbor that has been shot, and yet you have to put all those emotions away and give the best care possible to make sure that that person lives and have a quality life. And the way that this needs to take place is that we're giving the top-notch care in these emergency rooms. You're making quick, rapid decisions, life-saving decisions. You're working interdisciplinary teams to make sure that everybody's on the same page and that this patient gets the right care.
Sorry for interrupting, 1 second, but aren't nurses to some extent more at risk than ever before in those hospitals or in healthcare settings because of gun violence?
The violence goes into the hospital.
So if you take some place like UMDMJ, for instance, here in Newark.
We're talking about a university
hospital in Newark.
Right here in the heart of Newark. We are in Newark. Go ahead.
Yeah, so if you take some place like university, and if you have the two gangs have shootouts, then you have that ability at some point that both gangs may end up in that emergency room together. And if they feel like they want to continue the retaliation, then they'll continue it. The same thing with family members, though. It doesn't even have to be a gang. It could be family members. You know, you have these family annihilators that if they want to come in and take out the rest of their family that they didn't finish doing a job or something, then the nurses are right in harm's way because they're in that emergency room with those patients. So they can be shot and injured too. We've had hospitals down in South Jersey where nurses were caught between a husband and a wife down in the Toms River area. So we have that kind of data where nurse safety becomes an issue as well. So on the American Nurses Association, one of their things this year is safety on all levels for nursing, because we can't provide quality care if we're not safe, in a safe environment as well.
Right. Talk about the connection between mental illness and gun violence and what you can do about it.
Yeah. So one of the things that we see that's happening in the mental illness side is you don't have enough mental illness care providers anymore. So you don't have enough psychiatrists, psychologists, and that's where we have our advanced practice nurses who specializes in mental. So our psychiatric advanced practice nurses can fill that gap. because they can provide the care that the communities need as well as the psychologists and psychiatrists, and fill in those holes where you don't have enough services. Mental illness services have been cut back, so we fill in those voids. We need more, people sometimes need some place just to go talk. Mental illness still has the stigmas to it in families. I know as an African American, when you come talk about somebody being crazy or having mental illness.
Is it a cultural thing?
It can be sometimes
Hard to talk about?
Hard to talk about. Nobody wants to admit that they have issues, or that they need extra help, or that they need help dealing with daily coping, because it has that stigma attached to it. So, and this is where nursing can also help fill. We hear the stories when we're in the hospitals, you may be in your community centers, but it's that help after you leave the hospital that you still need that extra care and help with those mental illnesses. And I think we can work on making sure that those services are provided.
My final question here, Norma, is are we expecting too much? As you describe this, the mental health piece, the gun violence piece, the safety of nurses. Are we literally expecting, not just because we love nurses and you take care of us, are we simply expecting too much from nurses?
Yes and no. Yes on the fact that we're looking to fill all of those gaps, and no on the fact that that's why many of us go into nursing. So we take it on as a challenge to provide quality care no matter what setting we're in.
Even though that's not what you signed up for when you signed up?
Yeah, even though it's not what you signed up for when you signed up, because you may not know what your daily day, no 2 days in nursing is ever the same. So you can have the quietest day or the quietest week, and then all of the next week is everything under the sun falls on your plate, and we're just built and trained, we're qualified and trained to deal with whatever's thrown at us, and to try to take it on with pride, try to make sure that, and it always comes down to the patient care and quality of the patient care, and making sure that those patients are taken care of. And it's not even just the patient, it's the families and the communities that we live in and serve, and taking those services, for those people that can't get in, that don't seek out the services, then we seek them out, going out into our communities and seek them out, doing the health fairs, doing speaking engagements at other organizations, events, and constantly educating the community. And that's the only way we can make it happen.
All right. Well,
Norma Rogers is the president of the New Jersey State Nurses Association, and all of us thank you and your colleagues for what you do every day for us.
Thank you, Steve and Raphael, for having us. It is a true pleasure of being here and representing New Jersey State Nurses.
You got it.
Thank you.
My name is Carly Lloyd, and I have been with NJM since I first started driving. I'm a World Cup champion and 2-time Olympic gold medalist. If I could sum up NJM in one word, it would be extraordinary.
Extraordinary means being the best at something, separating yourself from everybody else.
I love being a part of NJM. They have the best insurance out there.
Join NJM's family of policyholders today. Get a quote now at startyournjm.com.
Also brought to you by Virtua, NJ Best, New Jersey's 529 College Savings Plan, and by Create.